My name is Nasan. Let's today discuss or talk about colon cancer. Colon cancer is among the leading type of cancer in the world that is killing so many people. The reason being it is diagnosed very late because its signs and symptoms actually look like any other simple signs and symptom of gastrointestinal diseases, irritable bowel diseases, and therefore confusing many people and doctors and nurses to concentrate on these digestive conditions and forgetting that it might be colon cancer. Therefore, colon cancer is most of the time is diagnosed when it has gone too far, like it has metastasized to other parts of the body, and now that's when they try to find out that where is the cause of this and why is this patient not responding to this treatment and so on. So it is always good for you and your family to make a routine of doing regular checkups, especially if you have a family member who ever suffered from cancer, and to be specific, whoever suffered from colon cancer, because colon cancer can also be found in history, family history. Okay, let us try to find out some signs and symptoms that might alert you to go for investigation or to try to find out like why am I feeling like this. We have changes in bowel habits. Like today you are constipated, after a few days you are having diarrhea, and it really confuses you. You really don't know, especially if you have not changed your diet, you are not over exercising, or you are not stressed, or you are not having any gastrointestinal diseases. It is always good for you to consider it as a warning sign, like I need to do more investigation. Number 2 is bloody stool. Bloody stool can be caused by so many conditions, including hemorrhoids, fissures, and any like GI bleeding due to ulcers, or if you are on any medication like ibuprofen, can cause corrosion on the digestive system, and therefore you might end up having blood in stool. This blood in stool can also be fresh blood or old blood. Old blood always comes out as black or melan. They are black in color, to use simple language, black in color. If we rule out all the things that I've mentioned or other factors, it is always good for you to go for investigation to find out like what might be another cause of this blood in stool. Later we are going to talk about some of the investigation that we need to do, but if you see blood in stool, it is also a warning sign for you to do more investigation to rule out colon cancer. Another thing is unexplained anemia, especially if you have bleeding, as I have mentioned above, that has already occurred. You are likely to go into anemia. Why will this be one of the signs and symptoms? Because when you are bleeding, you are losing blood, and also when you have cancer, there is what we call inflammatory process in your body that affects absorption of most nutrients in the body. Also there is you have been affected, therefore you don't have normal metabolism that your body is used to. Therefore, if your metabolism is affected, absorption and taking in most nutrients that are responsible for making blood in the body are also reduced or rather affected. Therefore, that's now you end up having anemia. When you have anemia, you feel you are so tired most of the time, and you are sluggish, resting does not help, and sometimes you can even have shortness in breath. These are signs that you are having anemia. And also you'll start having like you look pale. Try to find out like try to check if you're having bloody stool. It can also help when you are going to explain to the doctor. There are also what we call abdominal and pelvic pain. There are so many causes that can lead to abdominal and pelvic pain, but when you combine some of the symptoms that I'm going to mention with this, it's always good for you to go and check yourself. Also, when you start having, you are bloated all the time, bloatedness is not also a good sign. And remember, it is part of the digestive system, and therefore bloating will be part of it. So also another signs and symptoms 5 is unexplained weight loss. I've always said that we will never miss weight loss in any type of cancer. If you're having very fast weight loss, like this week you are losing 5, next week another one, and next week another one, try to go and do general investigation, not only colon cancer but all investigation that leads to cancer, because cancer really affects body cells, affecting so many things, therefore making you not to be okay, leading to weight loss. Also, due to due to this factor, you might end up having nausea and vomiting. If you end up having nausea and vomiting, especially vomiting everything, and you feel like you don't want to eat, it has affected your appetite, always try to seek out for more investigation. As I have said, you can see all these 5 or 6 signs I've mentioned. They look like any signs and symptom of a gastrointestinal disease or irritable bowel syndrome. So as you rule out all those conditions, try also to rule out colon cancer. What are some of the screening that we need to do as a family or as an individual? We'll need to do a colonoscopy, especially if you're having all the changes in the bowel habits and you are also bleeding, you're having nausea and vomiting. Colonoscopy will also help the doctor to take samples for screening and trying to find really out what the condition is. Also, you can do the blood test or what we call DNA stool test, depending with the hospital you are in or the location you are in. If they are able to do all this screening like DNA stool test, it is going to be very, very important to you and to get the right diagnosis. What are some of the risk factors that will make you suspect yourself like I might be among the people who might be able to get colon cancer? First thing is a family history. Any family member who ever suffered from colon cancer or any type of cancer, it's always good for you to give that history to your doctor or to your nurses or to healthcare providers so that they can be able to do the screening. Also remember, obesity has a lot to do with any type of cancer. A lot of alcohol, smoking, and your diet. If you're taking diet that is high in fat and low in fiber, is not a good diet. You need to take diet that has that it is high in fiber to help in digestion and therefore help to reduce the chances of you getting a colon cancer. Also, people who are black, we are more predisposed to colon cancer compared to white people. Every cancer has its own race. What I mean is race. It is one cancer is preferred in white, the other cancer preferred to black. But now this in colon cancer, if you are related to black or you are black or black American, where one of their parents or family are black, then you might be carrying the genes for colon cancer. All this is important for us to do the screening. Remember to subscribe to this channel and also to share so that you can get more information on cancer, palliative care, hospice care, and all the topics that I'll be discussing on this channel.